The owner texted saying that he did something to his leg and he was hopping on it and in excruciating pain and that they were on their way back.
I have so many things to say about this case.
He didn't love it when I'd have to lock myself in a room to study all weekend for a big test coming up, but he understood it.
Influenza is just everywhere.
It is.
It's just
It's in
making
my
its way
veins.
around to
Yeah.
everybody.
Don't fill your time with studying.
She was so good last time. I'm going to try again. And she bit me and broke skin.
Hello, everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know.
Hi.
Wow.
Hammer home. Reviews. We are at 316 on Spotify. We were
Wow.
previously at 311, and now we're at 122 on Apple Podcasts, and we were previously at 119.
Those are both pretty big
Quite
jumps.
the spike there in a couple weeks.
Listen,
I
I'm going
like
to say
that.
you guys' energy levels are down today. Like, what the hell?
This is horrible.
think
We
it
don't have
because-
people to talk to. We're talking to cameras.
We are now doing our podcast after the live show. What are we supposed
Oh,
to do?
I know. It's just like,
It's like in a lull. It's our first
Yeah.
podcast
Yeah.
back after the live show.
yeah.
And we
it
don't have
is.
the. I mean, we
And
can talk about the
we've
live
all-
show, but
We've all recuperated from the flu. Not all of us. I have. You are on like.
We all
how are
had
you
it to
feeling today?
different degrees.
Good.
Devin
Good.
was here,
And
and
then
then
it just went,
Courtney, and then me,
"Woo!"
and then King. Nothing.
Yeah.
Yeah, it got us good.
Yeah.
My
Yeah.
doctor called it the Florida flu. Apparently, it's a big thing.
The
Oh.
Florida flu is a big thing.
Huh.
So I got the Florida flu.
There you go.
Influenza's is also just
Makes
going
sense.
rampant.
I'm still recovering.
There's 29,000 people that went through VMX, I'm pretty sure, or something.
Yeah, something like
Crazy.
that.
So-
Huge.
I take my last Tamiflu tonight.
How's your gut? They didn't.
My gut's fine.
Okay. They don't.
My-
They don't give it to babies because it's really bad on their gut. I guess.
I'm just still nasally. My
That's
throat
not
hurts a little
recommended.
bit, but
Huh.
I'm at like 90%, I think.
Okay, good job.
Your eyes aren't puffy anymore. Really?
Yeah.
They are.
A little bit, but like they're not as bad as they
Dude,
were.
you should have seen them Saturday morning. Like, my eyebrows were like swollen over my eyeballs.
What?
I literally looked like an alien.
Did they say why your eyes swole?
No,
Like, got
it's
swollen
never
with it?
happened before. I think it was just the congestion and like the tiredness. And,
Oh.
but I looked in the mirror and I was like, oh my God.
Wow.
I think they're better than last week.
Yeah, I do too.
But they're still a little swollen. But thank you. I'm
Yeah,
glad that they're
you're
getting
welcome.
better. I've been like icing them and massaging and
Yeah.
doing the
It really
things.
rocked you.
Florida got the best of us.
It
Yeah.
did. I was down bad. Anywho, glad you guys are doing well.
Okay.
Oh.
Yeah. No, you go.
Okay, check
That's
out our
you.
social channels on Instagram and TikTok at the Veterinary Roundtable. You can also catch the video podcast on our YouTube channel, the Veterinary Roundtable. Their exciting news, our live show is also published there right now. So if you weren't able to make it in person, you can go back and get a recap and watch the whole thing on our YouTube channel, which is really exciting.
Yep.
So let us
And
know.
get excited for the next one.
Oh,
Yes.
yeah.
That's right.
It was
Yes,
a lot
yes,
of fun,
yes.
guys.
It was a
I will
blast.
So
say
much fun.
it blew my expectations out of the water.
It really did. Yeah.
Yeah.
But
It was-
you guys
it was
did say
fun.
listening to it was different than being
Watching
there.
it was
Yes.
much different
I'm
than
just
being
talking about
there.
So,
like
like-
the whole VMX experience.
Oh,
in
the whole
general.
VMX
Yeah.
experience.
But the live show also.
Yeah.
It was so much fun.
It's very you're just not in the atmosphere. Like
Yeah.
it's like I mean the atmosphere played a very big role in the
Yeah.
show.
It went by so quickly. I think I blacked out during it.
Yeah.
Oh, I definitely did because I went back and watched it and I saw things that I did not see
Yeah.
and I was right there.
I saw myself talking to the person next to me, and I'm like, "What am I saying?"
Yeah.
Like, I remember bits and pieces.
Just like
Yeah.
the nerves and the excitement.
Yeah.
and
It was great. It was
really
surreal.
good.
It went by
So-
really fast.
If you guys had fun, come to the next one. For all those who didn't make it, you
Come
should
to the
definitely
next
come to the next one. Highly recommend it.
I'm Dr. Emily King.
I'm Courtney Allen.
I'm Devin Fortune.
I'm Dr. Ashlyn Duckwall, and this is
The Veterinary Roundtable. Back in Westfield, Indiana.
Yeah.
30-something degrees.
Yeah, it's apparently supposed to snow tomorrow.
Yeah,
I
Did
Yeah.
you
did
see all
that.
the roads are lined and
It's
like 2
basically
to
do
5
my
inches too,
weather
or-
with whatever people tell me nowadays.
Yeah.
yeah, Jacob's my weatherman.
Yeah.
I don't know.
Yeah, I was told that today
Don't tell
also.
me.
Actually, someone was sitting on their phone in a corner and they slowly turned their chair around and they're like, it's supposed to snow tomorrow. I don't do well in the snow.
It's
Yeah.
so depressing.
I know, it was really cinematic.
One of these days we'll stop talking about it and bitching about it.
Yeah,
About the
I don't
cold
know
weather
when.
in
I
May.
don't know when.
Yeah, in May.
Yeah.
So Pits and peaks. What do you guys got?
Peaks. My peak was actually that I have come out the other side of the flu. Because that's the sickest I've been, I think, like my entire life. I had a fever for 4 days. Anywho, pit. I don't know.
Your eyes
But
got
you were
puffy
sick.
for the flu.
It's stupid, but I have been letting my nails get like way too long, and every day I've looked at them and I'm like, oh my God, they're really long. They're gonna break any day now. I really need to cut them before they break in half. And what happened as I was leaving work today, it broke in half.
Oh no.
So now I'm gonna have a little nub compared to all my other long nails.
Yeah.
It's
Did it
okay.
hurt? How'd you break it?
No, I threw something in a trash can and I looked down like, it happened.
There's something in the trash can.
You gotta add some like nail strengthener
I
stuff or
know.
whatever.
Well, they're just so long.
We'll file them down tomorrow.
I will.
It's your day off.
But
It could be
filing
your day off activity.
Cutting and filing my nails takes like 30 minutes. I dread it.
You could pay
I
someone
still
to
have
do it.
2 nails with the red
But-
on it from our life.
I got rid of the red the second we got back.
Yeah, Courtney wasn't a fan.
I'm not a red nail girl. It's not my
You guys
color.
look good at them.
Yeah, it's fun.
Thanks. It was fun
Yeah,
for the
I'm glad
show,
I did.
You
but
should try it next time.
I'll
Okay.
never get red nails again.
Never again.
No, I was not a fan having red nails.
That's okay. It could be worse.
Mm-hmm. Okay, I'll go next. My pit was, I don't know if anybody remembers, but I talked about going to Cleveland a few weeks ago. We were supposed to go this past weekend. We did not go because Jacob, my husband, is very mad at the Browns right now. So he did not, I mean, that was like it's kind of like our joking reason, but it was just also, it's a 10-hour drive for like a 12-hour trip. Like it just doesn't really make sense. And it's cold. So meh. But they requested to trade Miles Garrett requested to trade off the Browns, which is the player our dog's named after.
But is that the
I don't-
Browns' fault?
Yeah.
Because they're horrible.
I mean, why else would
Yeah.
you want to leave the team?
I guess so.
It's a losing team.
I've been mad at Miles
He's
Garrett.
a very talented player, and he's not being used how he should be because the team sucks so bad.
Okay, I take it back.
So I will support Miles Garrett wherever he goes. I don't blame him. I would want to be traded.
Where do you
as
think he's
well.
going to go?
Everybody's saying the Chiefs, but that's not going to happen. He's not going to the Chiefs. I don't know where he'll go, but he's not going to the Chiefs.
Maybe he's
If he-
coming to Indianapolis.
I
you
would not be
go.
muld about that would be fantastic. I'd be
I
fine
mean,
with that.
that would
Indy
be
needs
crazy.
something
But
to
the Colts
change.
also aren't great. So, I mean, this season they weren't great.
No, they weren't.
So, I don't know if he'd want to go to the Colts.
Guys, I'm trying to get into sports, okay? I'm working on it.
Not, and I will not try to be.
I
I'm
love
into
sports.
tennis.
I went to my first
Pretty
basketball game
basketball.
this weekend. I
Yeah.
watched the Super Bowl, the whole Super Bowl. I'm going to work on it, okay?
Good job.
Yes.
Pretty impressive.
My peak was seeing Patrick Mahomes on the ground so much during the Super Bowl.
He was on the ground a lot.
I mean, they were playing horribly, but I think they need to be put in their place. They're a good team, but I'm happy the Eagles won because I
How
think
was
somebody
your-
else deserves to win.
How'd your dad take that game?
My father-in-law,
Mm-hmm. Oh, it's your father-in-law?
my
that's
dad
the
likes
big-
the Colts.
Okay.
He was mad,
It
but
wasn't like...
I mean, they've won twice. He was fine with them losing. Like he's
Yeah.
got a few wins under his belt, so
Mhm.
he didn't. I mean,
Okay.
it is what it is.
I saw the Chiefs
I walked in
theme
his house
cookie
wearing
cake.
green though, and I got a nasty look. So that was my goal.
All right.
That's all I got.
Let's see. For me, my pit was the Kendrick Lamar show at
Mhm.
halftime on the Super Bowl
Why? Can I ask why?
because it was okay. I'll say
Ghetto?
this. No.
Okay.
I'll say that I did like the red, white, and blue. I thought that was really cool.
Yeah.
Like how they
The
then they
dancers
did.
were entertaining.
Yes,
Yeah.
the dancers were entertaining, but I was like,
You just
Yes.
don't get it, Mom. It's
You know
okay.
Do you know the whole
Yeah,
message behind
I
his
read something
performance?
saying like you
No.
can only enjoy it if you know all the
Yeah,
messages.
you
but
have
if
to
you
know
don't
all
know
the
messages.
messages.
yeah,
There were
well,
like a
What
crap ton of
messages?
messages.
yes,
I can read them if you'd like
Like
to.
the-
Because
you
it's
know,
a big
like
thing.
him and Drake have been butting heads. Like
He called
making
out Drake for being a pedophile.
making
I don't know if I can
diss
say that.
tracks.
Well, then Serena Williams was there.
Serena Williams is Drake's ex.
Yeah, that's why she was there.
Yes.
To throw it in Drake's face.
yeah, see, like that.
But
like,
no,
let's
there
just-
was
Can we
more
just
to
have
it.
like
Can you do that with an
entertainment?
adult
like,
true story
is,
conversation?
Like
That
the
is
not,
entertainment.
not like a
No, that,
song
like,
that he
that
kept
is,
teasing
like,
and then finally
cross
played. Like
appeal
that's just
to
a diss track
everyone.
to Drake. Like he literally said, "Say Drake," and like smiled at the camera, and then the whole A minor thing. Like they're talking about like A minor
That's the point of
because
this.
Drake goes after.
They're saying Drake
minor
is associated with P. Diddy too.
Oh my god!
It's a whole
Not back to P. Diddy.
It's a whole
See,
rabbit hole.
there we go.
It's a
Why
whole
we do
thing.
not
I mean,
need
I'm in the same boat as you. I was like, the dancers are cool.
Yeah.
Okay,
Red, white,
so
blue.
SZA
Kendra-
is also Drake's ex, actually.
Kendrick
She was
Lamar
there.
is one of the most influential rappers, which
That's
is why
a
he was
long
there.
paragraph.
22 Grammy Awards, blah blah blah.
Wow,
22.
22.
He earned 5 Grammy Awards off that one song, Not Like Us, last week. It's a diss track for Drake. Okay, P. Diddy allegations, blah blah blah. There was a lot of symbolism during his performance because they had Uncle Sam.
Oh yeah,
It's a whole list.
Samuel Jackson.
But
Yeah.
Samuel Jackson
I don't
was
know.
Uncle
I
Sam.
don't
I
think
did
he
get
was. I mean,
a
he
lot
was
of it
trying
has
to get.
do with like Black History.
He was trying to get
Month,
messages out rather
Yeah.
than. But
I
I
couldn't understand what he was saying though.
Yeah.
I also
Yeah.
really enjoy Kendrick Lamar as well. Like,
I think
like
the
his music.
vocals were like you could not understand. Like even if I didn't understand what he was saying, how he was saying it, you couldn't
That's fair.
understand what he was saying.
Oh,
Yeah.
really?
Not like that.
Oh, I could.
I'm thinking like
But I
from
know
a
the song.
Yeah, I didn't-
microphone perspective, you
Yeah.
could not understand what he was saying.
Really?
Like it all slurred together. Like I didn't think that there was like enough like
Yeah.
where you could like be like
It wasn't like enunciated very well.
Yeah.
Yeah.
like where you could follow along and be like, oh, A minor. Like even if you didn't know what he was talking about, you could have at
Yeah.
least
Mhm.
anyway.
Yeah.
I also
That's
think
fair.
Rihanna set the bar really high.
Yeah.
She did good. I liked her
Yeah.
halftime show.
I did realize that Kendrick Lamar has a very cute smile.
I know.
Like every time
I
he smiles,
agree.
it's so cute.
He's
I've
also
never seen him
very
smile.
short. I didn't realize how
Yeah,
small.
I didn't realize how
Yeah.
short
He's
he
so
was either.
small.
He's
But
also
John Batiste
37.
was there.
Yeah.
That was awesome.
Yeah, saw that.
Is that your
And
peak?
It was no
Huh?
Chris
Is that your peak?
Stapleton.
No, my peak.
I know.
No, there was no. And then Lauren Daigle also sang. A
I know
song.
I saw that, and I was like, King loves this.
These are the generations.
Yes.
I know.
Yeah,
Lauren
I love
Daigle's your
Lauren
guys.
Daigle.
Well, she's older than you guys, but basically, you're still your generation.
Hmm.
John Batiste is probably older, slightly. Maybe I don't know.
I don't know, but there's a documentary about him.
Yeah.
I started watching it.
On Netflix.
Yeah,
Yeah, it's good.
I didn't finish it.
My peak is that I got to do a TPLO surgery with Cloud
Oh,
on
yeah.
Monday.
How
Did
did
you
you
do
do
your
your
technique?
knowledge?
No. Well, I mean, it was the same technique. We just used
Oh.
all of
You
the
didn't
equipment.
use
Like,
the VMX technique.
no, we did. We used
Oh.
that same technique, but just
See.
different equipment.
Gotcha.
Her,
Because
you know,
remember, she had less equipment than what we have.
yeah, it was
Well, she
good.
got taught.
Carla did fantastic.
Nice. So
And
she's
it
gonna
was
do
fun.
it that way.
Yeah, I mean, you could do it. I mean, I don't think there's really that big of a difference,
Oh, okay.
you know. So they just used the jig, which we didn't use in the lab, but everything else about the process is the same.
Oh, see, I thought it was you learned something different, and you said it was easier.
No, I learned the exact same process with
Less materials.
Yeah,
Okay,
yeah,
gotcha.
yeah. It was interesting because I was like, "Is there a reason we can't?" So like, you put a pin in for the jig,
Mhm.
and then you know it's a pin on it's a intramedullary pin that's pointy on both sides,
Yeah,
and so you drive it in,
Mhm.
and then you got to cut it off, otherwise it's in your way.
yeah.
Mhm.
And I was like, is there a reason we can't just take the other half of that pin and use it on the other side of the jig? And they're like, and I was like, I mean, like, I'm just talking as a practice owner. Like, why don't we just, what are we doing with the other half of that pin? Are we just throwing it away? Or like,
Well, isn't
Yeah.
it dull after?
no, because the other end wasn't drilled into the top of the pin.
Got it.
It just,
But I thought you'd.
no.
drill-
It's drilled it's like a drill, like a
Oh,
handle.
okay.
This is like a,
Mhm.
you know. And so then, so they're like, oh, it must be because when you cut it, it's rough on the edges and it can't go into the sleeve of the pen. You know, they talked about, and I was like, okay, sure. And then so we get towards the end of the procedure and they're taking out the cut pens
Yeah.
that they cut, the pens that
Mhm.
were cut. They put the drill over the cut end of the pen, which they said you couldn't do to use the cut end of the other pen. You see what I'm saying? So like you drill the pen in and you cut it with
Yeah.
bolt cutters. It's
Yeah.
now cut
Yeah.
on the end.
Okay. Yeah.
The other half that came off
Yeah.
has a cut end and a sharp
Yeah.
end.
Yeah.
They didn't want to take the cut end and put it into the drill. But yet when they had to remove the pens that they had cut
Yeah.
that were in the dog, they put them in the drill. And so then I'm like, and they came to their own realization,
Yeah.
Helena and Cloud, and they were like, oh, we are putting the cut end of the pen into them. I was like,
Mhm. Yeah.
and I was like, so you can just use that. Then you don't have to have as
Yeah.
many, you don't have to order as many pens. You don't have to, anyway, it was just fun.
Huh.
One pen,
That's
two
what
patients.
we have Dr. King for.
Yeah, see, I'm good for that. I was good for that. And another piece of information
More
I told her.
sport.
That's exciting
Yeah.
that you got to use your 17,000 hours of time. I feel like I didn't see you for a week that day. Like,
For real.
So that was that. That was, yeah, it was great. It was
It's
a lot of fun.
exciting.
Good.
So
That's always fun.
Your pits and peaks.
Oh,
I know we're still on that.
yeah, we are. My pit is, well, my baby's sick, which sucks. But because she's sick, I have to call off work tomorrow, and I hate doing that, especially like when I feel good. It's kind of weird. Of course, I'm happy to take care of my child, but it's
it feels
also
weird.
It feels weird to say, "Hey, I can't
Like
commit."
you're fine.
Yeah,
There's
yeah.
nothing physically wrong with you.
Yes,
The one
But-
that has to work. Yeah.
It's just
Is what it
parenthood.
is.
You
It
gotta
is
be
what
a
it
mom.
is. Yep, and
It is
thankfully
what it
I
is.
work in a place that understands that. So
Mm-hmm.
we'll just catch up on Friday. I said, put everything everywhere. I was like, fill up
Oh,
my schedule. I
gosh.
don't care. Here we go.
We'll check back next week.
Right, we'll see how.
Check in on her technician
On
next week.
Tuesday next week, the pit's going to be my schedule on Friday. Really sucks.
We are accommodating everybody. My peak is my cat Cork. I love him. Just Cork. He's just a good boy. He just brings happiness to
I
everybody
feel
in
like
the
he's getting
clinic.
a little fluffier.
Yeah, he's maturing.
He's mature.
He's not a year
Do you wanna
yet.
explain
Still,
Cork in his life?
You know what?
Does everybody know where Cork started and where he is now?
Cork started. My friend's outdoor cat got Prager's. Had 2 unexpected kittens.
Oh yeah.
And yeah, so I took him. Originally, I was going to take his sister, but I took him instead. And he originally started as a barn kitten. That's how I was able to get him with my husband allowing it. And he just we got him at 6 weeks. So he was just molded into this friendly,
perfect.
just cuddle, social, fun, quirky type of cat. And when we unexpectedly lost Walter, our hearts were so sad, but I didn't want to go out and get a new cat and start afresh. There's a whole commitment there. And Cork just had a lot of personality similarities to Walter. So we brought him in from the outside, and
The outside.
yes, from the barn, only the barn. He's been transitioning since December, so it's been a slow transition to make sure everyone accepted him. So
Good.
he's
That's
just the
awesome.
best boy.
So cute.
He's a good boy.
Mhm.
That's
It's
it.
fun.
Very cool. Very
Okay.
cool.
Moving on. Trending veterinary
Ooh.
topics.
Oh,
Mm.
yes.
New
Speaking
avian
of
influenza
influenza.
genotype found in dairy cattle.
Influenza is just everywhere.
It
Ugh.
is.
It's just
It's in my
making its way
veins.
around to
Yeah.
everybody.
I mean,
Every species.
Are you surprised?
no, I was going to say every virus is going to shift and change
Mutate
to
and-
adapt.
yeah.
And isn't this the whole same influenza with don't feed your cats raw food?
Yeah.
That's the
I
same
believe so.
strain.
Mhm.
Strain.
This
strain.
one that's in the birds and most often, and now it's
Why
The
do
poor
people think- I
cows.
feel like it's always the birds.
The poor cows always get the short end of the stick.
Oh,
I feel
God.
like it's always the birds, though.
I mean,
Birds are
I did
always the
read that
problem.
there's no studies or
They're
no
more mobile,
positive
they're
tests.
dirty.
they can get places
Uh-huh.
easier.
That's true.
There's no positive test for dogs, and it's just the cats that have been exposed through raw meat. But your backyard poultry can get it too. So if you have poultry,
chickens, ducks,
yeah.
turkeys.
So if they act, basically, I read if they act weird and show all these signs, then report it to
How
the
does
government.
how does a duck act
Excuse
weird?
me, government. My duck's acting like a crackhead. Can you come check
Seriously.
it?
You
Oh,
might
they
want to
act
check your
weird.
ducks.
I've had a couple wobble out of nowhere. This is pre bird flu.
Interesting. Stay
Pre-flu.
far away from the duck wall farm.
Yeah, no.
Well, I think, didn't they say in here somewhere
Their waddles
that,
off. Must be the flu.
that the wild and migratory bird populations, they infect a broad range of mammalian species?
Yeah,
Well, I mean, they're literally airborne.
Yeah, they're worried about the wild birds mostly.
Mhm.
So if you
Mhm.
see a dead wild bird, report
Wild
that
bird.
to the DNR, right?
Every single dead wild bird. You know how many birds my outdoor cats kill?
Well, they might get the flu.
I mean,
There's literally nothing I can do about that.
There's nothing you can do about that.
no. There's
That is.
It's called the
that's
circle of
life.
life.
Yeah, I was gonna say that's hard.
Is there anything else educational we need to be telling our
That
listeners about
they
this?
do think that it eventually will mutate into a strain capable of human-to-human transmission.
Oh,
Oh,
sure.
great.
Everything
Maybe
everything
that's what I have.
mutates.
They do.
Makes
I mean,
sense.
everything
I would've already
mutates.
Just
said,
this
I
weekend we
really should've
talked
bet
about
against.
the swine flu
Yep.
and how
The old
schools
swine
shut down
flu.
when the swine flu went around.
There are a
Everything-
bunch of
everything
schools
mutates.
shutting down now with the flu.
Mm-hmm.
Yeah.
I mean, just so they can clean and keep people.
Okay, but that's what happened with COVID, and then
The whole
You
world
saw
shut
how that
down.
went.
Like, what do you mean?
I don't know. I just feel like maybe shutting down completely isn't a great idea. But I don't want to get into
Those
politics.
poor mom and pop businesses.
I don't think it's like that. I think the schools shut down when they have
You got-
like a certain
too many
percentage
kids.
of their
You got to
population
keep a
that's
certain
sick,
number of germs in the environment.
and then they go through and
Mhm.
clean it up. Maybe. I mean, I don't know what their numbers are to trigger that type of like.
Maybe we should
Yeah.
shut down
response.
the clinic.
I think we've already kind of run through it at this
I
point.
think it's hit everybody.
Is it? Has everybody gotten sick?
Everybody is sick.
Mhm.
Everybody has something.
Yep.
It's official.
Okay. Well, don't know if we provided any education.
Check your cows.
check your cows, check your birds, check your cats.
If your
Yeah.
duck's walking weird.
Your duck's walking weird. That's
You heard
right.
it here first.
Yeah, I don't
Yeah,
think
it's the
there's
flu.
anything else really. in
I
that
think
article.
it's just like part of this. I mean, it's good to have, obviously, from a credentialed source that, hey, be on the lookout. And like we get emails from BOA, which is the animal health in Indiana, to keep like veterinarians and the people in the field aware of what's going on. But outside of that, it's like, okay, there's a healthy level of information, just like there is in the whole world, and there's fear mongering. So just common sense. If you don't feel well, go to the doctor. If your animal feels weird, call the vet.
Yep.
Don't worry about anything else.
And Duckwall and I are proponents of zinc.
Yes.
Oh my God.
Zinc helps your immune system. Zycam sponsor me. I'm back on the Zycam train, so I don't get RSV. So
That's right.
Dude, I thought the bottle said 14 days maximum.
No, I looked it. I sent a picture in our group chat.
Well, she had a break. She took a break after VMX.
Yeah,
so
a
she's
1
fine.
day break. I don't think that counts.
Oh.
It
Well, I
just said
haven't-
consecutively 14 days if it's true, and so she stopped.
I'm not wobbling weird, so I'm fine.
Oh my gosh.
I'll ask my doctor at my next annual. Check my zinc levels. Okay, listener inquiries.
Okay.
The first one. Enjoyed the show. I do shelter work. Margie Garrett.
Excellent. Thank you
It's just a blank state. Like,
for coming
That's
to
awesome.
the
it's
show.
amazing.
And thank you for doing shelter
Yeah,
work
that's
because that is
yeah.
not easy.
Take
Not-
a special,
yes.
extra special person.
True that. To be in vet med and then to do shelter work.
Write
Yes.
in and
Well,
tell
I'm
us
glad-
what you think
yeah.
of VPAs and shelter work.
Ooh. I'm glad you
Ooh.
enjoyed the show, though.
Yeah.
Thanks for letting us know.
Thanks for your support.
Absolutely.
Okay, next one.
Okay, next one. Hello, friends. I'm a third-year student at Texas Tech. We do not have a teaching hospital, and I personally prefer it. Many of our core practice partners are specialty referral practices. I think we'll be very prepared to offer a spectrum of care options, not to mention the amazing network we gain through our partners. I think it's important to remember our professors are still the majority of board specialists. Love listening to your podcast. From Anonymous.
That's awesome because
Yeah.
that was after the conversation about, some of these new schools are not going to
Yes.
have
Yeah.
teaching hospitals associated
Yeah,
with
Talking
them.
about what we
And what is the
prefer.
pro and the con?
Yeah, and we
Yes.
asked people to let us know.
That's
Yeah.
because
really
we
good
didn't
to
know.
know.
So
Thank you, Anonymous.
that's good that they will feel very prepared for the spectrum of care. That's huge
Mm-hmm.
Yes.
because there's going to be so many spectrums.
Mhm.
So that's awesome.
To know that. and be
Thanks for
comfortable with
sharing.
that.
'cause-
Plus, too, it is kind of cool that they basically are networking the entire time they're
Mhm.
working at those practices.
Yeah.
So
Huh.
that's like an added plus as well.
It's like getting an in once you graduate.
it's kind of like a job shadow in a
Right.
way. You Just
Mhm.
see what
Yeah.
if you like it.
That's
Okay.
great. Thank you.
Yeah.
For the insight.
Okay, next one. Hi, I am starting tech school in the fall and also have a reactive dog, a 1-year-old cattle dog. I'm curious what you guys do when you get reactive or fearful dogs and if you have any tips on working with them. The clinic I work at, we don't seem to see lots of those fearful pups. I obviously know how to handle mine, but just wondering if you have any thoughts. Thanks for all you do. From Allison. I love that question.
Mm-hmm. Yeah, it's a good. I'm surprised they don't see a lot of fearful pups, but that's
Yeah.
good, I guess, for the clinic.
Maybe
Yeah.
They're doing something right.
the dogs they use in tech school are like really well trained or something. I don't
Mhm.
know.
I would say taking your time, which is not always ideal. But like when we get fearful dogs, or we know we have one coming in, or we know we've seen them before, we try to accommodate and block time out on our schedule so we have time, because I think rushing makes the experience worse for everybody involved. Because if
Mhm.
you're already fearful and then you have someone coming at you really fast and trying to poke you and get stuff done quickly, it doesn't help anything and it makes the pet worse.
Mhm. Go slow, soft voices,
treats,
not a lot of like outside stimulation.
Yep.
Medications.
Yeah. Don't be
Yes.
afraid of the meds. Bringing your fearful dog in. I
Happy
mean, we-
visit.
Yeah. Happy visits and
Yeah.
things like that.
Happy visits at the clinic are basically owners come in and walk their dog around and let them sniff and smell and observe and get treats and then go home.
Yeah.
No,
Sling
they don't
and
charge
done.
for it. They just come on in.
Sling. That's a good one.
I think it just depends on what motivates the dog. And I think some do better in a very quiet, smaller space. So we'll go to x-ray sometimes. Some just don't want restraint and do the sling. Some need their owners. There have been many times where we're just meeting a reactive dog for the first time, and I take the entire, like, I'll expand it to an hour appointment if I can, and just sit there and talk with the owner or pet the dog, and then we call it. Like, we use that as I do most of the exam, like what I can, but then we say, okay, is this good enough? Are you happy with the owner? And then we just come back another time for shots. So don't be afraid to call it. Like, be the voice and say, no, this is not going to end well if we just keep pushing the animal. So,
yeah, for sure.
Don't be afraid of full sedation.
Yeah, don't be afraid of full sedation.
Because that makes all the difference in the world rather than trying 15 things and then needing full sedation.
Depends on the goal of the owner.
Yep.
We had an owner who's also a behaviorist trainer. She brought in so many different type of treats and then also a sound machine so that the dog didn't hear a lot of the background outside noise outside of the exam room. It was a really good idea.
She also shaved the dog before coming in so I could get blood so I didn't have to shave her.
Yeah.
And then put lidocaine cream on her for me. And so she is amazing.
Yeah.
She's great.
Yeah.
A
lot of different steps.
Very
you will
cool.
see. You will see one eventually.
Yes,
you will see one.
I like them though because it's really fun building that trust.
Yes,
it's very.
It takes
very
a lot of
rewarding.
extra time though, so you have to set that expectation with the owner. Like if their goal is to us to do like the whole visit in one setting without a lot of whatever you call it, restraint or meds or whatever, then it's going to take some time. So
I will say, speaking from personal experience, there's a dog that comes in and she's had pop-ups that she can be a little spicy. She's a Chihuahua mix. And then she came in last week for a low-dose dex-suppression test, and we drew blood on her 3 times, and she was perfect for all of them. I was giving her the benefit of the doubt, didn't have to muzzle her, didn't have to do anything special. Then she came in a few days later. I was like, she was so good last time. I'm going to try again. And she bit me and broke skin. And so I drew blood on her and she was perfectly fine. There are pop-ups for a reason. They might have just been a good day, but
she was having a great day.
I know, because
she was perfect
that day, because she told me, because I drew blood for her, and I remember her saying she had all these pop-ups, but she did fine for me. You'll be fine. And I did it without a muzzle. We did everything normally.
Yeah.
And she was fine.
If there's a note on the account, I would just go off of that.
Let's just go off.
believe it.
Yes.
Yeah, she was in a great mood that one day.
I've also had dogs change over the course of time. There's one Chihuahua mix that I have. Every time he would come in for years, great in the exam room with the owner. Everything nose to tail. And then grandma brought him in one visit and she's like, yeah, I can't look him in the eye. He'll go after me and saying all this behavior stuff. And I'm like, gosh, I just never had trouble. Literally, I start in the back, work my way forward. I do the eyes like normal. And he went full blown. I'm going to kill you. It was the weirdest thing I'd ever seen. So I don't know. It could obviously change with the people that bring him in too. But I had never seen that. But I instantly lost trust because he was going to get me. He's a small dog, but so that's also weird. Just be prepared.
You said yours was a Chihuahua?
Chihuahua mix.
Notice how both of ours were Chihuahua mixes.
Not pickles.
Yeah.
Okay. Anyway.
Okay, I feel like I haven't done this in 7 years. All right. Don't forget about our text message feature for our podcast. All you do is tap on the episode and whatever podcast provider you choose. You look at the top, it will say send us an inquiry through a text. You go ahead and click that. And then if you would like a shout out, include your name. Otherwise, it will come through as anonymous.
Okay.
Solid.
Case collections.
Case collections.
Mine's interesting. So it's a 10-year-old Beagle Basset mix named Charlie. And she presented for, I think, ear infection or something. She came with her brothers, and there's this new bump on her back, mid-back. It's about, I guess that would be, a quarter? The size of a quarter. It had grown pretty quickly. I saw her in February. It had grown since December when they noticed it. It was red, hairless, bright red, kind of crusty. So with it growing quickly, we sampled it. And on the cytology, I saw one mast cell. And then in a lot of inflammation. I can't remember what else. It's been some time. But with one mast cell and the characteristics in the history of how fast it grew and the way it looked, I said, let's just remove it because there's no reason to keep it if we're concerned. So I was thinking it was mast cell tumor, but we got her in really quickly, removed it. I got really great, like, around peripheral margins. Deep margins, I thought I did pretty good, which I'll kind of explain. And it was on her back, so I got to the muscle but didn't have to go in the muscle. So we get the histopath report back, and it actually came back as a soft tissue sarcoma. And it said that my margin, it was completely excised, and my margins were quote unquote clean, but my deep margin was only 1.8 millimeters, so it was narrow. And anyone who knows soft tissue sarcomas, if you imagine like this round circle on the top, but then like octopus tendrils going down underneath, that's kind of how they operate. They go deeper. They're very locally aggressive. And that type of margin I wasn't comfortable with that. So I consulted with an oncologist to make sure I wasn't crazy. So I presented everything to the owner, and I said, hey, to the owner, I was like, it says I got it all out. However, with the type of tumor it is, it's different than what I anticipated. And the way it behaves, I'm not comfortable with saying like, we're good to go forever. So our options included just monitoring it for regrowth recurrence at that site. Referral for radiation, potential chemo discussion, and potential surgical like scar revision going back in there, versus scar revision with us only, without any extra radiation or chemo. And I think that was it. And we discussed throughout this, like, if it's a soft tissue sarcoma, if it's going to go anywhere there, it would go to the lungs. It was a 30% chance of reoccurrence at the site. It was low risk for metastasis. But after going through all of everything, the owners felt the most comfortable with checking her lungs and doing x-rays there just to make sure. And I said, okay, we can do that here. And then that came back clear. There was no sign of metastasis. So then now the conversation became, do we go in for a scar revision and I get deeper tissue, not necessarily wider. I would just go in and scrape out more deeper. It would be another surgery, a quick turnaround. It would be maybe a little more uncomfortable if I got into muscle, versus monitoring and, saying, hey, there's a 30% chance she's 10 or 11. What do we do?
Right.
So last I talked to them, they said they were kind of thinking about it, but thinking we'll just monitor. And I haven't heard from them since. So I think that was the decision. So you basically treat the scar from the original surgery as dirty tissue. So you go in as that's your starting point, and you get margins around that and deeper than that, which I just haven't had to come across yet before. But it's always good to send out the mass histopath. Yep. That's just another confirmation that it may look like something, but confirm it if the owners will let you, and convince the owners to let you send it out.
Yeah.
So, well, we'll see. Hopefully it doesn't come back.
Hopefully it
There's
doesn't
70% chance it won't come back. That's how I look at it.
That's right. That's right.
Cup half full.
Yeah.
Okay. My case is a 9-year-old Australian Shepherd, male neutered. He actually came in this morning for a tech appointment. He just got his Librela not vaccine, but his Librela shot. And then he got home, and then like a couple hours later, the owner texted saying that he did something to his leg, and he was hopping on it and in excruciating pain, and that they were on their way back. So they get back. History turns out that they were giving him a treat, and he's an old man and has arthritis, and he landed wrong when he jumped for the treat on their hardwood floor, and just landed wrong, hurt his hind left leg, and he was very uncomfortable. He was trying to bite us when we were palpating it, like no weight whatsoever. There was a little bit of swelling. So we proceeded with sedated x-rays, and the first view was a left lateral, and it showed a dislocated hip. So we continued on with the series, and then in the VD, it wasn't dislocated. And then we like start teetering back and forth between all these pictures, and in one picture it was dislocated and the next it wasn't. And then I'm not even kidding you, this went on for 2 hours.
Why?
And then wait, what? No, like he's sedated. It was a lot of like back and forth with the owner, and the dog wasn't really he never actually fell asleep. Like
gotcha,
we had
gotcha.
and then
Okay.
process.
we eventually had to give him ISO because we were gonna try to put his hip back in place.
It was so painful. Probably he's like,
so
It's
painful.
going in on its own. It's
Yeah.
going
So
in and out
painful.
on its own. It's loosey
So
goosey.
we gave him ISO, got the hip back in place, took an X-ray. It's in place. We placed is it Aimer sling?
Oh,
Aimer
yeah.
sling.
Sling.
Placed that,
Useless.
which
Go ahead. Keep
was
going.
which was a feat in itself. And then took an X-ray. Guess what?
It's out.
back
Yeah,
out.
obviously.
Yeah.
So that's why it took 2 hours. And then we discussed a lot of options with the
I mean,
owner.
he's a big dog. He's
Yeah.
a big Aussie.
Yeah, he was like 50 pounds.
Oh my god.
Discussed lots of options with the owners, and they decided to do an FHO tomorrow.
Oh, good.
So he is scheduled for an FHO tomorrow, and
wow.
we just gave him a Rimadyl injection, and some gabapentin, and
He'll feel
he's
so much
gonna
better
Get
tomorrow.
a surgery
He's gonna
tomorrow.
feel like a new dog.
Wow,
tomorrow.
giving him a treat made him just.
Well, here's the
Oh.
deal. I have
That's
so many
so
things to say about
sad.
this
I
case.
know. I would love to hear them.
Go for it.
So, like, one of the problems is with the umbrellas, the dogs feel good.
Oh,
So if
yeah.
people do things that with their dogs they're probably not intended to be doing at their
Mhm.
ages
They
because
push the limits a
a
little
lot
bit.
of the time, we're using this on older patients.
Mhm.
But that breed in particular is known for having shallow acetabular rims.
Mm.
He probably has lived his life
Yeah.
subluxating
The
his
other
hips.
hip didn't look
Mhm.
too great either.
Right. And so with very shallow rims, then if he's acting like a circus dog, standing up
Mhm.
straight up and down, then he is just going to just shove that right over the edge.
Mhm.
But for him, it was probably living like halfway out.
Yeah.
And now it was all the way out, but it was going in and out on its
Mm-hmm.
own, which would say that he had a shallow, and it was
Mhm.
subluxating back and forth.
Well, it doesn't help the ligaments, the tendons, the
It was-
muscles, like with that chronic
Yeah.
in and out or whatever.
So there's a ligament, right, that attaches the femoral
Mm-hmm.
head into the acetabular rim.
Mhm.
And so when he popped that out, either that was already previously torn or he tore it,
Mhm.
but there ain't no getting it back in there.
Mhm.
And I laugh only because I've been where Dr. Ham's been
Yeah.
and gone through all those things. And if that was me today, I'd be like, this is what I can do, but we're not going to do that because this is
Mhm.
what's going to happen if I do it. So the only option you have is to do surgery tomorrow.
So why
Yeah.
do why do they even teach the Emer sling anymore?
I don't even know if they do anymore. I mean, I
It
don't know
was
if they're still
rough.
teaching it. It makes one.
It's
The
a
dog's going to
terrible
chew
way
its
to do
leg
it.
And
off.
he was so fluffy.
Yeah.
Like,
I mean,
it just
the
kept
wrap around the
slipping and-
metatarsals is
Yeah.
uncomfortable. The internal rotation and the hyperflexion. I mean, that dog probably has arthritis in its hock and its knee, and now we're putting in an extreme
How long are
flexion.
you supposed to leave it in? Isn't it
A long time, but then
Yeah.
as soon as
The
you
sling is like 10 to
With-
14 days. I
Yeah,
think.
Oh
that's,
my
that's what I'm
God.
saying.
you're going to
That's
have rubbing
absurd.
injuries from the tape bandage. You're going to, and a lot of times they'll pop
sounds
out and the
horrible.
owners won't even know it. But now the dog's not using the leg because it can't because it's in a
Mhm.
sling.
Yeah.
But yet the hips popped out.
Mhm.
So now we're putting it in an out position for 10 to 14 days.
Mhm.
Like it just, none of it makes sense. I
I
don't even
can't even,
bother. I don't even give
yeah.
people an option. It's like, this is what you do.
I can't imagine the amount of pain he was in. We gave him full dose Dextorb and ISO, and he was still like
Oh, I
Yeah.
believe
yelping
it.
in
Ouch.
pain
I don't
when we
wanna-
touched him.
That's always the thing I think you taught me where it's like that type of bone pain is so extreme that you go to just slightly touch it or maneuver it.
I don't even
and
wanna think of-
you,
ugh.
you would know. Like,
Yeah.
like even if you can't, I mean, probably, I don't know if Pam felt it before the x-ray, like if she could feel if it was out or not.
That's
but
when he tried to bite her.
yeah,
Yeah.
it's that usually obviously fractures and osteosarc. Those are the
Any
ones
kind
that,
of bone pain. Ugh.
Yeah. Bone
Yeah.
pain's like,
because
It
even
was
like even torn cranial cruciate ligaments, like they're uncomfortable, but they're not
They're not
uncomfortable
doing
to
that.
the point where they're doing that.
Right.
Like
Yeah.
they're trying to bite you. So
It was
Yeah.
a gnarly emergency. He got there at 1, and I think they finally left at 4. And I felt like it should have been like 6 p.m. by that point.
yeah, those are hard. I mean, once you do that now, this time, then it's about a 10-minute case
Mhm.
in the future.
Yeah.
Because you don't, there's just no messing around with that
Mhm.
stuff. You just
Right.
don't mess around with it anymore.
yeah,
You
There's
just,
one fix.
one fix,
Yeah.
one fix only. And I tell
or
them,
a total hit, but I guess
right. And I tell them,
Yeah.
like, you can do this, you can do this. This does not make sense. In a 12-year-old, 10-year-old, whatever dog
Right.
it is,
Mhm.
he already has shallow acetabular rims
Yeah.
anyway. I'm going to put this sling on. You're going to be really mad because it's going to come back out again. And it makes no sense to do it. So here's your option. Do
Who's
this.
doing it tomorrow? Are you?
Cloud.
Cloud and I'm going to do it. Help her.
Yeah, we were going to do it on Thursday. Ham was going to do it, but there's already a lot of surgeries, so we can't.
Yeah. Poor dog.
No,
That's one of those dogs where I literally used to see him once a year for his annual. And now he's like,
who is
one
it
thing
that he
happened.
needs to do?
Yeah. Well,
yeah. But he's going to feel, to your point, he's going to feel so much
it's gonna
better.
feel so much better. And it was one of those X-ray. Boom. You have the answer. Done.
Yes.
Let's just do.
Put him on the schedule for tomorrow.
It's not like
Thanks,
an awkward
bye.
fracture where do you have to refer it? Do you have to do a blah, blah, blah. External?
They're the best ones because there's no exercise restrictions post-op. There's nothing. Dog can't injure it. Can't make it worse. I mean,
You're literally gone.
It's literally like the best orthopedic procedure because it's considered a salvage procedure, right? Because you're not fixing anything per se, and you're removing something with an osteotomy. But I mean,
You're taking away the problem.
it's just fantastic.
Yeah.
Because you're like,
you're
there's
excited
nothing
to
your
be
dog
involved
could
in
do.
that
Yeah.
tomorrow,
I
aren't
mean,
you?
it's just great. It's just a
Yeah.
great procedure.
Nice.
Easy
So-
peasy.
Good luck,
Good,
Murphy.
good. Murphy's going to do great
Yes.
until he
Feels so much better.
luxates his other one.
Well, that's
That's
Fingers
that could
crossed.
happen. I've had that happen to one dog where they did the dog did both sides because they were really shallow.
yeah.
That's type of thing.
Ouch,
What can you
yeah.
do? Can't do anything about it. What can you do? Cool case, Devin. Good job.
Very cool
Thank
case.
you.
Okay. Hello, my name is Joe, and my partner is waiting to hear back from some vet schools. She's already been accepted to a few. I'm going to follow her to wherever school she ends up deciding on. My question is, what can I do to support her as she goes through vet school? I'll have my own work to deal with, but I understand how rigorous vet school is, and I want to be as supportive and as helpful as possible while she goes through school. Love the podcast, by the way. We listen to it on long drives, and it keeps us sane. From Joe.
Nice.
Nice.
That's so
Thanks,
fun
Joe.
that he listened. That's so
and
cool.
That's so sweet that he's
That's cool.
reaching out to take care of her. I think it's sweet.
That is
Yeah.
really sweet.
Nice job, Joe.
Here's the deal, Joe.
It's a
You
grind.
can only help so much.
It's
No,
a
I mean,
grind,
really,
Joe.
it's not that bad. Don't make it into
Yeah, no, I'm just kidding.
a name that should not be
And just
mentioned.
support her
You know,
like
like,
you would with anything else.
It's not Voldemort since we were just at Universal. Like, right? I mean, like, it is what it is. It's fine. You're gonna survive it.
Yeah.
It's perfect. It's imperfect. It's all of those things wrapped up into one. But just enjoy the ride.
Yep.
Yeah.
I think it was super helpful when my husband would like just kind of take the lead on cooking dinner or doing the dishes or truly like I don't think he didn't love it when I'd have to lock myself in a room to study all weekend for a big test coming up, but he understood it. Or he'd help me study and it was funny. Like
Right.
make it funny.
Yeah.
But and after, doing that for 3 years of the book part of it, it takes a toll sometimes where you're like, gosh, I wish I didn't have to do this all weekend. I wish we could go do something different. Or I'm going to have to miss this one thing because I have to go study where he gets to go represent us. Like, it's not going to be all sunshine and rainbows, but I think just acknowledging like, this is just a short snippet of your time together. It will get better. You will get through it. Enjoy it by meeting some new friends and getting to know the partners, spouses, whatever of her classmates. That we made some great friends. Some of our best friends are through that. Go out and party with her classmates when they go out. Like, don't be like, I don't know these people. Just do it. Just meet new people and you're gonna have to do maybe 80-90% of housework for a little bit. I think it's just it is what it is.
Yeah. And I would say tell your partner that whether you spend 10 hours or you spend 6 hours, it's not going to matter. Like the
For
difference.
studying, I mean?
Yes.
Yeah.
Do not spend 10 hours when you could have spent 3.
Mm-hmm. Yeah.
That's all
After
I'm
3,
saying.
your brain's done absorbing.
Yeah. I mean, like.
It's like training a puppy. You can't train him for an hour.
I mean, you could try and beat stuff into your head for as long as you want, but like learn the information and stop worrying about grades.
Yes.
It does not matter. The grades don't matter. They matter in order for you to be able to pass and like graduate. But like, if unless for some reason they want to be something that requires you to have a I don't know,
internship, residency stuff,
something that would be very like grade driven.
Yeah.
But I mean, like study hard, but like I think don't fill your time with studying.
Mm-hmm.
Don't be like, okay, I have a Saturday.
Mhm.
I'm filling it with studying.
Yeah.
No. Say, I've got from 8 to noon to study. Because I guarantee you that if you say, I'm going to study from 8 to noon, you will get in what you would have studied from 8 to 5
Yes.
by knowing that my deadline is 12. I got to get through all of it at 12.
Mm-hmm.
And because you fill your time with whatever the time is, you fill it with the work.
Right.
Yep.
So I think
Agreed.
just,
And you'll find other projects to do.
yeah.
I mean, build stuff
Yeah.
or go.
But I agree with
Read
you
stuff.
completely, Duckwall. Like, if the other person doesn't have to think about, like, like the other, like, small nuances
Mhm.
of existing
of
together.
living.
Mhm.
Do you know what I mean? Like,
Yeah.
whether it be groceries, whether it be
Laundry.
laundry,
Mhm.
bills, like that frees up more time to focus on that. So then your free time is spent doing things together.
Mm-hmm. For
You know, but by no means as the secondary person in that school relationship should you put yourself on the back burner
Right.
either
No.
and say, well, I'm going to do all of it so this person does none of it.
Right.
Like, that's hard.
And it's
Yeah.
not to say that like his job won't take precedent during this 4 years of vet school either. Like it's always a compromise, but the nuance things goes a long way.
Yeah.
Or like convince her to take a study break and go to the grocery store with you.
Yeah.
Heaven forbid. Like
Mhm.
Yeah. Do the task together.
yes.
Yeah.
Yeah.
Yeah, for sure.
Yep.
But I think at the end of the day, it's just part of the journey. Make it
is.
fun.
Right.
It
I
is.
think those are good tips.
Because you
so-
can either be miserable or you can have fun.
Because at the end of the day, she's going to come home and be super grateful you're just there to let
Yeah.
her do whatever she needs to do.
Yeah.
Or I don't know, but
Mhm.
For sure.
it'll be fine.
It's going to be great.
It's going to be fine.
Have fun.
Best of luck.
Best
Thanks
of
for
luck.
listening.
Yes, thank you for listening. And thanks for listening, on your car rides.
That's so
Long
fun.
drives.
I wonder if he's in vet med.
I'm going to say no.
I don't
I
know.
find it so
But that's just a
interesting when
guess.
people not in vet med listen to our podcast.
I know it's cool.
We're fun people.
Maybe we're just sharing good information.
We talk about vet med, but we also talk about life.
Yeah, it's probably 50-50.
Just to circle back really quick because it's fresh in all of our brains. I'm just gonna really quick before you take us out.
Yeah.
Well,
We should talk about, because you said Universal. We should talk about our roller coaster that I went on. That should
Oh.
have been my pit.
That should have been your pit. Yeah.
We
Yeah.
basically took
came
her.
back to me.
We took her on the scariest roller coaster, and
Yep.
she
well,
hates
we were
roller
trying to get
coasters.
her to ride a roller coaster all day, and
Yeah.
then the one she rode was like the worst one.
That
you
should
could
have been my
ridden.
pit.
That should
Okay,
have
little
been.
backstory. Courtney hates roller coasters. Like, deathly afraid of
Oh my
roller
god, those
coasters.
Yeah.
were so fun.
And we went to the Universal,
I
and the
still
whole
can't believe
group,
she did it.
the whole
Velociraptor.
group went on the Hulk. That was the first ride they went on. I sat out with Richie and Calvin because, once again, I'm not a roller coaster person. Well, the whole time we were walking around, Jacob and everybody else, Courtney, just go on one. We're here. And I caved. I
You
said,
got the
okay, you
fast
know what?
pass.
You're right. I'm at Universal. When will I be back? I'll go on one roller coaster. We get to Jurassic Park World, and they're like, the Velocicoaster is going to be nothing. The Hulk was 10 times worse than it. We're just going to do it. And I was like, okay, great.
Okay, by they,
So
Jacob
we-
is the one that said that.
Okay, I'm pretty sure a few people said it to
It was
convince
so
me.
bad. It
So,
was so
We
bad.
get
It
on the
was so
roller
good,
coaster,
though.
and it did we have shoulder straps?
Yeah,
or was
that's
it,
why
okay.
you were
It was
okay
one
with
of the ones
it
where, like
too.
you're in a harness.
okay,
and you're like,
so
Remember,
we
your
get-
feet were off the ground.
Yeah, I know.
Okay.
So we get in the roller coaster, and lo and behold, we start. I mean, it was the worst experience of my entire
Wait,
life.
but it wasn't over straps because
That's
remember
what I
we were like when
thought.
you go upside down, that bar was the only thing
Yes,
holding
yes,
you.
we
in.
did. Because
Okay,
your
that's
feet
what
weren't
I
on
was
the ground.
asking.
oh
Yes.
shit, yeah, I just went over your lap.
Yeah, that's what I was like. We only had lap things, mind you. We were upside down. We were over water. We went in 17,000 circles. I couldn't even scream. That's how stunned I was. I sat
Her
there.
face.
And I didn't
She
move,
was
and
white.
everybody turned around, and
Yeah, I
somebody
wanna go
said I
do
was
it now.
white, and like
The whole time I wasn't thinking about the roller coaster, I was thinking about Courtney.
Yes. So we had to write it again.
Well, it was like
So we did.
everybody
rode
went
it
again except Courtney. I
Yeah.
held all the bags.
Yes.
Well,
You did
it
all
was
of
like you're going and then you hit that gust. It's like, and we were all just like Courtney.
It was when you were hanging upside down. It was legit. That was legit.
That was the best roller coaster.
I
I've
like
ever been
can't
on.
breathe
Yeah.
thinking about it.
I know. My heart's racing.
It was
Highly
absolutely the best.
recommend
I just wish,
Velociraptor.
we couldn't have our phones because it was that intense of a roller coaster. You had to have a locker to put your bags.
I knew it
in.
was gonna be good.
I wish somebody had their
when
phone to take a picture of my face when it stopped because everyone
I wish
turned
we would've.
around.
I
Yeah, I had a
know.
picture.
white. I knew it was gonna
Yeah.
be good. I think as we were walking up to it, like you had decided you were gonna ride this one, and it was gonna be the one. And then we walked up to it, and just out of nowhere, like it goes over our head, and they're all upside down and screaming. And Jacob and I just go, "Oh!"
Oops.
And then Courtney's like, "No!" But she did it. It was horrible.
Yeah, you did it.
I'm happy I did it, but it was horrible.
so much fun.
There was
It was-
nothing
it was-
fun about it.
Oh, it was legit.
But
It
I
was-
thought I was gonna die.
two was enough.
Yeah.
2 was enough.
I
Yeah.
was nervous going the second time,
Yeah.
knowing what we were going
Oh my god,
into.
it was so
Yeah.
good.
Yeah,
it
it
was
was
good.
really good.
Sorry, I just had to talk about that because
No, I'm glad you
No,
brought it
good
up.
point. Good point. The last
We're
thing
so
I'll
proud
say
of you.
before you take us
don't give
out
in to peer
Mhm.
pressure.
Courtney, you're
It's a
peer
single
pressured the
word.
whole trip.
Wagyu.
That's
a wrap.
And that's a wrap.
And we'll see you next week.
Thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. And if you're attending... Nope.
Nope.
We'll see you next
We'll
week
see you
for another
next week,
episode of the
baby.
Veterinary Roundtable.